Welcome back to Good Company. I'm Jordan Borders, and I'm on location today at Illinois Eye Center. When we think of painful eye conditions like blepharitis or dry eyes, we often think of those as occurring in adults, but children suffer from those as well. So today I am joined by Dr. Steve Lichtenstein, a fellowship-trained pediatric ophthalmologist, to talk to us about some of those common eyelid problems in children. So welcome back to the show, Dr. Steve.
Thanks, Jordan. It's a pleasure to be here.
Great. So tell us about some of these common conditions that occur in children.
Well, most of the time, the kids will get a bump on their lid, what we call a sty. Yep. Medical term is chalazion or a hordeolum, which is either an inflammation of a gland in the lid that produces part of our tear film, or an actual infection in the glands that are at the base of the lashes. Okay. And these can be uncomfortable, painful, and sometimes get very large.
Absolutely. And so what do these look like? How do they present themselves? How would you know if your child is suffering from one of these?
First of all, the child will probably tell you that his lid or her lid is tender. There's maybe a little bit of discomfort, pain. The lid will get a little bit red and then start to swell.
Okay. And as a parent, you know, you often wonder, when do I take my child to the doctor? How serious is this really? How serious is this? And when should a parent think about bringing their child in?
The first time it happens, I'm not that worried about it. What we do is we tell the parents to use a warm compress, warm water. I like to put in a heat sink into the warm washcloth, hard-boiled egg or a microwave potato, which keeps the heat there so the heat stays on the lid longer. The lid may actually look a little bit worse the first time or second time you use it because it's bringing new blood vessels in, getting rid of the infection or getting rid of the blockage in the meibomian gland, and then it goes away.
Okay. And so are there any children that might be more prone to getting these eyelid diseases, or are there causes that parents can look out for?
A lot of times kids who are in dirt, playing with dirty areas and then rubbing their eyes a lot can cause it. Now that we're getting into the springtime and the spring allergy season, kids rubbing their eyes with dirty hands can cause this to occur.
Okay. And you're offering a newer treatment here at Illinois Eye Center, Avenova. Tell us about that.
Well, Avenova is a new product that is made up of a substance called Neutrox. And Neutrox is actually in our white blood cells. Okay. It's a natural occurring product. The Avenova is the only product on the market that is 100% pure Neutrox. What it will do is will actually fight the infection, fight the lid disease from the outside. What we normally would do is use an antibiotic or a steroid on the lid. The problem is using an antibiotic too much, we can cause resistance. And a steroid, like any other steroid, on the eye, near the eye of a child, it can have side effects.
Sure.
So this has no side effects at all, and it does not cause resistance to the bacteria, to the antibiotics.
Wow. And so in those children that you've now treated with Avenova, what have their results been? How quickly does it help them?
Pretty amazing. We have a few pictures of some of my patients. The first little girl is a little Hispanic young lady who, if you look at her right eye, comes in very inflamed. And we tried to use steroids, mild steroids and antibiotics, and it did not do a really good job.
Okay.
I switched her over to Avenova, and you can see in the other picture to the left, in 3 weeks, that eye looks completely healed. Now the problem with this young lady is it's on the lid, but it's also affecting her cornea. And because the cornea is being affected, it can cause permanent visual damage to the child. So if we can use something like Avenova and within 3 weeks get that kind of result without an antibiotic and without a steroid, it's really a marvelous thing to use.
Absolutely, absolutely. And then I think you had another example as well.
Our second young lady is a young lady who has a syndrome called Kabuki syndrome. And her lids were really becoming very raw. As a matter of fact, I had to take her to the operating room one day to remove these surgically, and they kept coming back. You can see on the right picture that the eyelids look very macerated. They look like they hurt.
Very painful.
Very painful. And in 3 months, now this young lady, it took a lot longer than 3 weeks, but in 3 months you can see what her lids look like
Yeah.
and they were completely healed.
It's amazing. It does. It looks very painful, and as you said, it can be very serious if you don't start addressing it.
It can. If it causes corneal damage, causes new blood vessels to grow into the cornea, then we could have serious permanent problems.
Absolutely. And so are there any side effects from Avenova that you kind of watch out for?
There are absolutely no side effects from Avenova.
Wow.
It's also cheap. It runs $30 to $35 for a bottle,
Wow.
which is much cheaper than an antibiotic or a steroid.
Absolutely.
It's 100% safe, 100% natural, and has no side effects. I use it down to a 6-month-old baby that we've used it on without any complications at all.
Amazing. Well, Dr. Steve, thank you so much for joining us today and
Thank
talking
you.
about this. Helping kids out is always a great thing. If you'd like to learn more, you can visit Illinois Eye Center online at illinoiseyecenter.com, or you can also give them a call to schedule an appointment at 309-243-2400. And don't forget, they've got 2 convenient locations, one in Peoria and one in Washington. Dr. Steve, thanks again.
Thank you, Jordan.
All right, keep it right here. We've got more good company coming up next.